In April, we had to stand up our isolation and quarantine system overnight, and no system is ever going to be perfect when it involves the contribution of humans and therefore human behaviour and human error in a dangerous and tricky virus. So while we can never guarantee it will be completely fail-safe, the review has certainly found that there is more that we can do to reduce risk. I also want to put our managed isolation and quarantine system in both a global and national context. We are also one of the only countries in the world even attempting to do this. And I think it's really worth noting that. Nearly every other country is only requiring home-based self-isolation with no testing, a system we had here up until April 10th, but which proved unsuitable for stopping the spread of the virus. Our 14-day government-managed isolation with compulsory day 3 and 12 testing is the strictest system anywhere in the world that we are aware of. At no point in our nation's modern history have we ever held in isolation and quarantine facilities the sheer volume of people that we are currently dealing with. The global pandemic is getting worse, not better, and Kiwis are increasingly returning home from international hotspots, and more of them are bringing the virus with them. We currently have capacity to isolate around 6,000 people at any one time in 21 facilities located across Auckland, Rotorua, Christchurch and Wellington. For a sense of scale, we are currently accommodating the equivalent of a small town such as Kirikiri, and the numbers are forecast to rise to over 7,000 in the coming week. It is a system that to date has also worked. So far, over 22,000 people have been through managed isolation and quarantine since April 10, when it became compulsory. In that time, there have been 53 cases in the facilities, or 0.2% of the total numbers through them. And importantly, no cases of COVID-19 in New Zealand have been linked to someone leaving a facility. In short, they have done their job of stopping COVID at the border and protecting the gains that we have collectively won as a nation. But today's review highlights that while the system was manageable under level 4, when there were only small numbers of New Zealanders returning home, it is now a system under stress, with arrivals increasing by 73% last week compared to the beginning of April. The review identified a number of issues, including the following. The current resourcing capacity was not sufficient to carry out forward planning for future demand. There has been insufficient structure and role clarity and a need for a clear chain of authority, which Air Commodore Webb's appointment seeks to fix. The Ministry of Health clinical policy directives appear to be discretionary at a DHB level. Communications with returnees has been insufficient. There was a lack of written information provided to returnees prior to entry, setting out what they can expect and, importantly, what their responsibilities as someone rejoining the team of 5 million are. The use of PPP on planes and transit and at hotels has been inconsistent, and health check procedures differ across facilities, and day 12 tests needs to be prioritised so that we can get those results in time to move people out over after that 14-day period has finished. All of this is achievable, and in fact, Air Commodore Webb and I have already made a series of changes in the last 10 days that are already making a difference in addressing some of these issues. For example, earlier this week we met with the senior management of Auckland Airport and have devised an arrivals process that means returnees on their way out to facilities do not come into contact with anyone else at the international terminal, and that the old Jetstar terminal will now be stood up for domestic transfer flights, so that there will be a full separation from the public. Air Commodore Webb will have more to say about arrangements at airports. In Wellington, those coming off the domestic transfer flight were met airside and put onto buses on the tarmac, again not coming into contact with any member of the public. The additional military staff at the facilities has resulted already in more stringent security arrangements and decreased movements around the hotel. We have also been meeting with local council, iwi, DHBs and other stakeholders in places where we are standing up facilities to ensure each city is ready and prepared for running an isolation facility. And we will also be signing contracts with DHBs that will include a ratio of health staff to returnees that will ensure adequate staffing levels to complete all day 3 and 12 testing, daily health checks, and the provision of any other health services required, such as mental health, while returnees are in isolation and quarantine facilities. These service level agreements with DHBs will create an accountability mechanism to ensure services are being provided where and when they should be. And it's now my pleasure to hand over to Air Commodore Webb to set out the actions we'll be taking in response to the review's finding.
Thank you, Minister. As Minister Woods has said, we have a system that has worked well for us. It did what we needed it to do in the immediate emergency response. Nonetheless, it is currently under some strain and it needs to be scaled up to meet future demand. This is all doable. As of today, we have seen 22,832 New Zealanders return home. We have grown capacity to 5,764 beds. 4,692 are occupied across 21 isolation and quarantine facilities in 4 different regions. In 7 days' time, the projected current demand is 5,877, and we have a plan to have 6,584 beds online to meet that demand. To say this has to be a finely tuned operation is an understatement. But we have an operational team that are working incredibly hard to assure that supply meets demand. Minister Woods has identified the issues in the report, and for us these fall under 3 main themes: clear lines of accountability and responsibility, making sure we have adequate resources on the ground to support the operation, and standardised, robust and clearly communicated procedures to all involved. We've said it before, this system relies on those returning New Zealanders to understand and to follow the rules. This is a serious obligation and we have clear expectations around those individual accountabilities. A number of actions have already been put in place. While this review has been an important part of how we can deliver a robust system, we have not been waiting for it to land before taking action. First, the need for increased resourcing and capacity. As you know, last week I announced a doubling of the on-the-ground Defence Force staff of 32 across 18 facilities. I'm pleased to report that as of today we have 168 NZDF personnel across 21 facilities providing 24/7 coverage. The total number involved across the Defence Force system is 238, and this includes people supporting the planning, the training, assurance and necessary surge capacity. There are also more government staff across the end-to-end system. Ministry of Foreign Affairs and Trade, Police, Aviation Security, whānau ora, Health and Fire and Emergency staff all contribute to what is a significant all-of-government response. Nonetheless, demand continues to grow. The system is enormously complex and we will need additional resources to go into planning, health checks, testing and communicating with returnees. And work is underway to do just that. In terms of procedures, a range of activities are underway. For example, Minister Woods mentioned the arrangements we put in place with Auckland Airport to ensure the safe and streamlined transfer of passengers through the terminal on arrival. We are working with Auckland Airport to enhance these arrangements further, utilising a separate international arrival facilities and the utilisation of a remote domestic terminal to transfer returnees to other centres on dedicated charter flights that are of course completely separated from their fellow Kiwis. In a similar vein, on Friday we met with senior managers from Christchurch Airport and we have agreed on further strengthening the separation mechanisms there. These mechanisms are in response to the increasing challenge of operating level 4 protocols when the community is at level 1. The Minister and I have also been talking to airlines about measures we can take to better smooth and manage demand. Regardless of what facility you're in, there should be consistent operational delivery. This will also assist with reporting. Health guidelines are the basis for our operational practice, but I will also be looking at it from an operational setting. The review of PPE is a priority. The audit found there is inconsistent use throughout the whole process. Simplifying and standardising what is a complex environment is crucial. We are working with health to ensure the guidelines are up to date and consistently applied. The government's testing strategy has determined that returnees, border staff, airline staff and those who work in the managed isolation and quarantine system are our greatest risk for picking up the virus. The outbreaks in isolation hotels in Victoria serve as a reminder of the need to ensure all these people are adequately protected. In regards to communication, we are standing up a formal system of communicating with returnees at all points of the process about managed isolation. Pre-departure, when they purchase a ticket, in-flight, on arrival, and then ongoing throughout their 14-day stay. A comprehensive information pack is provided to all returnees. Good information and instructions should help to reduce some of the negative behaviours we are responding to in the facilities. Critically, we have strengthened the exit processes. No one leaves a managed isolation facility without returning a negative COVID test. Ensuring all day 12 tests are taken on day 12 and results prioritised and returned on day 13 means people can depart efficiently on day 14. Most of these actions are already underway. When fully implemented, we will make a good system better and stronger. With more and more New Zealanders seeking to escape COVID overseas, we need to maintain a robust border and managed isolation and quarantine system to prevent community transmission.